Oh, holy shit.
Welcome to the practice. What can I do for you, sir?
Experiencing a lot of pain in my upper back, and apparently I've got a pretty bad deviated septum too. So.
Well, we can see it right there. It's it's definitely deviated over there.
Yeah.
And you also, I believe we discussed in the consultation, you also want some help with the TMJ as well?
TMJ, yeah.
Okay, so let's break it down. What happened to the deviated septum? How'd you do that to your nose?
I fell down on my face, and when I stood up, it was a little crooked, so.
That gotta hurt.
Did not feel good.
All right. And which nostril you have trouble breathing through?
I think the right one's worse. I mean, I guess it's hard to. Yeah, I think it is the right one.
All right.
It's usually the trouble one.
Okay, so we'll take a look, see what's going on with your deviated septum, the TMJ, and that upper back / neck problem. Okay, so the first thing I'm looking for is, upon the visualization, we're looking for is there any muscle spasms or swelling, and we're gonna start correlating all the data. So you was talking about neck pain, upper back. So we've got some muscle tightness on this side, so swelling on that side. We're tracing around, we're looking for some pitting edema and some swelling. And we got something right here. And we got this one over here, and we got some redness over here too. And look at this, there's a bump over here. So this feels like a rib head, so we're gonna mark that rib head. Looking straight down here. I got some swelling down here as well. And next thing we're doing is we're using this device here, this instrument, and we're looking for signs of increased heat or decreased heat in the opposite direction, which indicates possible potential areas that we need to take a closer look at. Got a reading right here. Reading right there. All right, let's take a look. It's not too bad. It's a little fixation on the left side. But right now, what I'm doing is I'm overlaying the data. I'm seeing the X-ray into your spine. And right now, your fifth lumbar, that's not moving at all.
Okay.
All right. Now this is very swollen over here.
Yeah, that's the spot.
Yeah, see, that's not moving at all.
Yeah.
That's 6 dorsal right there. And we got this nice little rib head right there. That doesn't feel fun too either.
No.
No, it doesn't. Okay, we're gonna mark that. How's this poor fella right there?
Definitely feels stiff.
Yeah, there's that second dorsal right there. You feel that huge knot right there? Yeah. Right there, that joint capsule swollen over there. 7, 6, 5. Feel that right there?
Yeah.
Yeah, that ain't moving. Go ahead and march in place. Yeah, see, it's left hip is not moving too well. But here's the interesting about it. Okay, so stop right over there. Okay, go ahead, lean back as much as possible. Okay, go ahead and march just your left foot, left. Just left. How do you like that? It's moving more. You feel that difference?
Yeah.
Okay, stand up. So what I did was this, okay, because your fifth lumbar vertebrae, it was backwards, okay, just by applying a little pressure, moving it forward, it freed up the nerve just a little bit, just enough to get a little more nerve power, and this false positive, it went away. Okay, so no, fifth lumbar vertebrae, that's the one we need to adjust on.
Okay.
Okay, so now let's piece everything together. So we're talking about the deviated septum, the TMJ, upper back and neck. So the upper back and neck, yeah, we can see there's something going on because look at this fella, it's curved up like crazy over here. But even though we try to adjust all this over here, no, I want to trace all this straight down. It's like, because I'm still seeing everything's curving like this way. and tracing all straight down. But here's the thing, even though also during examination I found, okay, the left hip was stuck and not moving, but it doesn't make sense to adjust this. The reason why is because right now this hip over here is what we call a PIX misalignment. That means that this hip over here, it went backwards like this and rotated that way as well. So if I adjust it, and the problem is your hip is lopsided like this way, if I correct this one over here, what it's gonna do is it's gonna make it even more lopsided. So it says, okay, biomechanically that doesn't make sense. It's not like you're turning the car to the left. The car should be turning to the left, but instead it's going to the right. It says, that doesn't make sense. So either you have a short leg over there or something else is causing a false positive. So we just tested, confirmed on you, that fifth lumbar over there, that's actually more in trouble. And because the nerve supply goes into the hips. So if this one over here, if that nerve is being irritated, and that's what we see over here as well, because you see these tunnels, the nerve got to come out of these tunnels, but it got a lot smaller on this one over here. So we got a serious canal stenosis over here, irritating the nerve. This hip is not moving too well, and bingo. That's how we get a false positive. So actually, this is the one we really need to address, okay? And then moving up over here, the sixth dorsal. Now it's rotated this way, but I also see all these ribs, they're all symmetrical, except the sixth dorsal rib on the right. This one is popped over this way. So that's why we need to set this one and that rib as well. Second dorsal, that's having some fun over there. We'll adjust that one. And we also have that fifth cervical is swollen this way. So we'll take care of that one. Now let's get to the fun part. Let's take a look at this deviated septum over here. Now, ideally it should be nice and straight over here. But you see, it's like over here and over here. But here's the more fun part, because when you fell, okay, see this black line right smack in the middle of that? So this is actually fractured. So basically, it should be over here, but no, it went like that way over there. Now, there's no way for me to permanently fix that because that bone right there is broken over there. You may need plastic surgery after all, but I'm gonna do my best to try to realign these two fellows over here as much as possible. And also, see all this black space over here? Okay, I wanna see more of that. You see this? There's more white stuff over here. So that tells me, no, the right maxillary sinus is all clogged up, filled up with pus. Okay, and all that debris in there. So no, we also gotta be adjusting your sinuses as well, clean all that junk off. And we also got that TMJ over here. You see, this is normal alignment, but you see how much it dropped over here? So your jaw, it dropped down like that way. So now we're gonna take care of this right TMJ as well. Here we go. Oh. First things first, let's get this rib in place. Okay, let it go. Oh. There's one. Oh my God. Okay, drop the belly. Okay, let it go, a little more. Go out the belly, a little more. There's the rest. Right there.
Yeah, that does feel, I mean, I haven't been able to look this far left or right without turning my whole body in like 2 weeks.
Great.
Yeah, that's...
Okay, let's take care of the TMJ. Okay, so go ahead, open mouth, close, open, close. Got it. So open, close, open, close, open, close, open, close, open, close. Okay. I'm gonna get a little more in there. Open, close, open, close, open, close, open, close, open, close. Okay, the left is a little bit out too.
Yeah,
open,
it's clicking.
Close, not too fast. Open, close, open, close, open, close. Okay, all right, try the TMJ, see how I like it.
Yeah, I'll be able to tell when I eat a sandwich. That's the true test.
It will give you a big sandwich from South Chris Charlie's, huh?
Yeah.
Okay. Block off your left nose. Go ahead. Yeah. Okay. Now block with the right. Yeah, they're both not fun. Okay, first things first, we're gonna set this piece.
Oh, holy shit. Sorry.
That's all right.
Oh my God.
It was really out.
Yeah.
And we're gonna set this upper part. Oh, there he goes. Now we're gonna set the nasal bone because the septum sits, it's connected part of it. See, I could tilt this way. See, it doesn't go that way. So just set this way. I know. It's really jammed. It's old because this is an old injury. Yeah, I gotta do a little more. I know it doesn't feel fun. Oh. See, now it's moving. Okay, let's just like you figure. See, this right maxillary sinus is not moving at all. There it goes. It's a little stuck too. Right frontal stuck. Skin was a little bit out. There it goes. Go ahead, test the nose now. Tell me, what's different in there?
Definitely feels a little less congested.
Mm-hmm. How much better would you say breathing right now?
I'd probably say like a 30% increase. I mean,
Good.
it's hard to say. But yeah, I guess time will tell too with that.
Yeah. So what you can do is speed up that progress, okay? Just get a steam bowl, put a towel over it, okay? Breathe the vapors in. We want to get all that junk out of there. It'll take a couple of days to get all that debris out of your sinuses, all right?
Awesome.
All right, man, we're all set. I'll see you next time.
Thank you so much.
Oh, you're very welcome.
Appreciate it.